But if you are feeling stressed and anxious because of the coronavirus outbreak, you are definitely not alone. The virus is also making children feel scared and often vulnerable. But there are ways for parents to ease their children's fears as this virus continues to spread. So joining us now, we have Dr. Robin Goodman. Thank you so much for joining us.
Good to
now,
be
I
here.
want to get your title right. So you're a clinical psychologist, and you have some tips for parents on how to help speak to children about this. Now, there is so much information passing around. It's especially complicated for children to understand. So what is the best approach if your child says, what's going on? What is this?
Well, first thing is you want to know your child. Also think about their age. The littler the child, the less the words. The bigger the child, the more words. And also the littler, they don't process the information. They have made fantasies and things where older kids will hear rumors. But you want to be the source of information and reassurance.
So it's important that you have as many facts probably as possible as well. So how do you begin that conversation? Maybe they're asking you, maybe you're the one saying, okay, let's dive into this a little bit.
Right, no matter what, normalize it. So you say, I hear people at school or on the news, there may have been more things about people being sick or having a flu. What have you heard? So you always want to start with what they know and what they're afraid of, rather than lecturing or just giving information. You want to find out first what's on their mind, and then you can answer appropriately.
And I know there was some information passing around, can kids get infected? Some people were saying some can't, but are children at risk? Are there some especially at risk?
Well, I think when they're at risk, it's if they are already anxious. So you know your child. Maybe A, do they have more fears to begin with? Or B, are they somebody that gets sick more often? And then you might be able to say, we always take care of you. This is what we do. And again, normalize and put it in the context. We wear seatbelts. We have smoke detectors. We wash our hands. We do things to stay healthy. We take care of you. Even when you're sick, we always get better. And we know what to do as your mom, your dad, whoever.
Right. It's like a flu, and there are precautions that you can take. Now, we do want to pull up. We've got a graphic board here, just some points here to help people have that conversation with their children. So I'll just run through a couple of those things. So the first, be honest, be careful about too much detail, be age appropriate, tailor the information, and then also be in the know and know what your kids are watching. And you were just alluding to that. There's a lot floating around online.
You may want to watch with them. You may want to ask them, and before you debunk it, say, let me hear what you see. Let's talk about that. So you want to validate maybe that they are worried, and then you want to go in and address misinformation, talk about how they should come to you with questions. I think the thing that's there is not only know information, know yourself. Fear is probably more contagious than anything else. Right. So as the adult, the more calm you are, wouldn't you want to spread calm?
Right, and that's a very good point for everyone, not just for kids. Now, we do have another graphic board we want to pay attention to here and focus in on. So these points, you also want to be attentive. You want to listen to children's specific worries, be open to questions, and also allow expression of feelings and how to cope. So how important is that in managing fears, being able to express yourself?
Right. So what do you do in general when you feel worried? Let's have a dance party. Let's go out for a walk. Let's play with the dog. So, you're never going to get rid of all anxiety in life, but it's like we learn how to manage it, just like we learn how to take care of ourselves when we feel sick or have a cold or the sniffles. We can take care of ourselves when we feel worried too. It's all about taking care of yourself and managing it as a family. How do we work together to help each other?
So doing things to take your mind off of it. Now, what if your child is quiet? Maybe they haven't brought this up. When do you know if your child might need to speak to a professional, perhaps?
Well, that's when you see it interfering. That's what we always look for. Sometimes intensity, like it's too much, like they're quieter than usual. It's going on too long. It's like, a couple of days maybe they're down or whatever, a lot of things are going on, but now it's going on too long. And also it's interfering. They're not going out to play. They're not involved with their friends. You say, what's really going on? It seems like maybe you want to talk about this, start with you first. So you're the safe person, and then say, this is what we do. We always go to professionals whenever we need extra help, whether it's a teacher, a tutor, a doctor, or a feelings person.
Right, and we have been talking about these plans, and so we have these last points here. So important to be aware and review your own family safety plan, so everyone's all in on that together. And then also to be hopeful. I thought that was an important one. Spreading a positive message. We all need more good news stories, right?
Right. So, like, what do you do if your friend is homesick or if your brother is not feeling well? You always want to maybe, let them play with your toys, or depending on what it is, or let's go, let's text our neighbor and see how they're doing so you don't have that contact. So there's lots of ways to stay connected to each other, stay connected to your community that maybe is not hands-on, and then see how you are as a family. And safety plans means taking care of each other and everyday good hygiene.
Yeah, I like that advice. We've been talking about washing your hands 20 seconds, sing happy birthday, wash them that whole length of the song, right?
Because when you can do something, then you feel empowered rather than hopeless or helpless. So when you can help yourself or help someone else, it then takes care of that feeling overwhelmed.
Well, Dr. Robin Goodman, such great advice. Thank you so much. And we are going to have a full list of some of these tips up. And so for that information, you can head to our website. That is cbsnewyork.com.